definitely we have to talk about BBLs. Have you seen the increasing number of women that are doing it right now in Uganda? Like every single day. It's now becoming like any other cosmetic procedure, which I don't want to say. But yeah, the number of people that are doing it in Uganda is increasing every day. And I was like, why don't I talk about BBL? First of all, what you have to know is BBL is one of the most common cosmetic procedure right now in the world. And secondly, medically, it is also one of the procedures with the highest risk of serious complications. So the problem is people only see the results. Someone can find you and they're like, oh, Samantha, you have a nice bum bum. They don't ask you, what did you go through? What did you experience? They only want to see the results, but not the reality behind the results. So that is why I was like, why don't I make a BBL video to break it down for you in detail, medically, realistically, and honestly, so that you can know what a BBL involves before you go for the procedure or the surgery. So watch this video, not because I want to tell you what to do with your body, but because I want you to make an informed decision. I want you to have information before you go and you have complications afterwards. So before you even go further, my name is Samantha. Welcome back to another topic or discussion. Don't forget to like, share, subscribe. Like, why aren't you subscribed? Join the family so that you don't miss out on any of the other topics that I'm going to bring forward. So let us start by understanding what is a BBL. A BBL stands for Brazilian butt lift, and it is also a fat transfer procedure, meaning that we are not getting a foreign material like implants and putting them in your bum. No, we are using your own fat. So they can get fat from your stomach, from your back, from your thighs, from your arms, wherever there is sufficient fat. They can get that and then they use it. And there are also three components that you have to know that involve a BBL. The first one is removal of the fat, then processing of the fat, and then re-injecting this fat into your bum bum. So definitely people do these BBLs for a number of reasons. I would love to combine it into emotional, social, and psychological factors. The first one is social media influence. We are constantly being exposed to off-fed, these curated bodies. You have the small waists, wide hips, big bum, and over time the brain starts to normalize this as an ideal body. But most of these images, first of all, they are edited, they are filtered, and they're also surgically enhanced. So you look at someone's picture on social media, for example, IG, Instagram. Most of these Instagram models look perfect. Like you look at them and you're like, oh my God, someone is posting gym. I'm not saying that gym doesn't work. It takes some time. But someone has only been in the gym for a week or 2 weeks and they're showing you this big bam bam. And then for you go and you do a BBL. So do not believe everything that you see on social media. The internet is not a real place. People post what they want you to see. Someone can make you believe whatever they want you to believe. So be careful. Do not follow these trends. Sometimes you're just being deceived. Another thing why people do BBLs is because of body dissatisfaction and also comparison. So you find people comparing themselves to influencers, to celebrities, and even friends. Now, comparison is a thief of joy. The moment you start comparing your body, your business, your job, anything of yours to maybe a friend, to maybe a workmate, a celebrity, or anything, you will have insecurity. You will never have enough. You will never enjoy what you have. You'll never look in the mirror and you're like, oh my God, I look good. No, you will always be comparing. You'll always be thriving to have what the other one has. And even if you reach that, you will never be satisfied. So you find that some of these people do it because they're just not satisfied with my bum bum, the way it's looking. Let me go and do something about it. But of course, some women came out. I think I watched a video on YouTube. Some lady came out and said, you know what? People are attacking me because I worked on my bum. People are saying this and that and that. But for the longest time, I've had insecurities about my bum, the size of my bum. It's okay. Do whatever you want to do. But don't compare. Do not see someone and you're like, I want to build exactly like that person. Because this person, maybe first of all, they are natural. Some people have natural looking bumps and they look good. So sometimes you may be comparing something that is real and you're going to do a BBL, get complications. I'm not saying that no one has insecurities, but what I'm saying is sometimes talk to yourself. Talk to yourself. We all have insecurities. We are all not satisfied with some parts of our bodies, but that is the body that God gave you. And what the BBL does, it gives you a quick transformation. I already said that the gym takes months to years. There are people that go to gym and they have good bodies, but the BBL will give you a quick transformation. With the gym, of course, you're not only gymming, you're looking at what you're eating, you're looking at the discipline. It comes like a whole package. Some girlies are like, that is not for me. I am not ready to do this, do that, do that, do that. What am I going to do? I'm going to go for surgery. That's going to get my excessive fat, put it behind me, and let me get my what? My nice looking bum. And that is where the problem comes in, because after some time, I will talk about what will happen. Another thing is social and relationship pressure. So some people are influenced by their partners, peer groups or peers, and also trends within the community. First of all, never follow any trend in the community. Right now, it is Ozempic that is on. Everyone is losing weight like they're being starved. I do not even know how they started. But every celebrity you see, they have their bones out. I do not know what is happening in the Hollywood community, but anyways, right now it is Ozempic that is on. There was a time where people were looking like glasses. Someone comes and has a very huge bum and then they have a small waist. And now it's not on. So never follow any trend. Today you're growing fat, next thing you're losing weight. Don't follow trends. When it comes to peers, no person, no friend of yours should influence you into going for surgery. Go for small tattoos. Have them in between your fingers. Those ones, okay. Never go for a surgical procedure because you're influenced by a friend. 99% you're going to regret that. When it comes to your spouses, your husbands, or your partner, whatever you want to call them, I don't think he loves you when he tells you, hey, go and work on your bum. Hey, I think your breasts have an issue. I can't remove that fat from your face. You're looking a weird way. I don't think that person loves you because it starts small. I remember, I think a friend of mine showed me a video of a woman on TikTok. She was saying how her husband was sending her pictures of Instagram models with small waists, wide hips, big bums. And then he was telling her, you know what, babe, you would look good like this. He was trying to tell her that she would look good like this. And then she said she went and did the procedure. But that pain was even more than childbirth. That is what she said in the video. These are not my words. But what I'm trying to say is she's not now with the guy. They divorced. But what I'm saying here, it starts small. Hey, work on your bum, you work on it. Hey, I think we have had a lot of kids. Try lifting up your boobs. You do that. Before you know it, he's making you into something that he wants to. So never be influenced by your partners. Because first of all, I don't think a person who tells you to change yourself loves you. Then lastly, there is a deeper layer of self-esteem and identity. Some people believe that changing their bodies is going to change the way that they feel about themselves. Let me tell you something, you're going to be confident for a temporary period of time. But surgery does not fix inner issues. It would be better if you would fix those things within yourself and then the confidence would radiate out on its own. Because definitely people are going to tell you that you look good, but inside you may be as miserable as the devil. So make sure that you fix your inner issues. Maybe go out and do a small surgical procedure, but never do a surgical procedure thinking that it is going to solve your inner issues. Moving on, now let us understand how a BBL is done. We are going to take this step by step so that we don't leave anyone behind. The first one is consultation. Now, consultation is not just a conversation between you and your surgeon. This is where your body mass index is evaluated, your fat distribution is assessed, your medical history is reviewed. So here they might ask you, do you have hypertension or a high blood pressure? Do you have diabetes? Do you have clotting disorders? And also your expectations are going to be discussed. Now, I always tell people, as long as you get your car money, go to the reception and pay for a consultation fee. Ask everything that is on your head. It may seem stupid, it doesn't make sense to anyone. Ask everything to your surgeon. And then another thing is not everyone is going to be qualified to do a BBL. So if you do not have enough fat, you will not be qualified to do a BBL because here we need fat to do the procedure. The second one is anesthesia. So most BBLs are done under general anesthesia, meaning that you are unconscious. So your airway is being managed and your vitals are being monitored. But this alone carries a lot of risks, such as respiratory depression or allergic reaction. I have seen people come in walking, people driving themselves in a surgical procedure and then not coming back alive. So during consultation, make sure that you tell your surgeon everything, because I know there is going to be proper medical assessment, but make sure that you inform him about everything, because some people don't make it out alive. The third one is the liposuction, which is the removal of the fat cells. So fat is removed by inserting a cannula under the skin. So this involves breaking down of the fat cells and suctioning them out, the way that you hear it. Get a cannula, put it beneath your skin, and then they suction out the fat cells. But this also affects the blood vessels, which leads to the risk of bleeding, swelling, and trauma of the surrounding tissues. Because of the way that is done, it normally affects the surrounding issues. Following the liposuction, we have fat processing. So the removed fat is filtered, washed, and separated from the blood and also the fluids. So only the visible fat cells are selected for re-injection. Fat injection is the most crucial step. So fat is injected in small amounts in layers to improve the survival of the fat cells and also reduce pressure buildup. So if this fat is injected incorrectly, especially deep into the muscle, and it enters into the large vessels, it can travel to the lungs and then bring about fat embolism, which is life-threatening. The last point is recovery. Now, this first determines the outcome. For example, revascularization. The new blood supply must form to supply the excessive fat cells that they have put in your bum. And then also another thing, there is inflammation. So there is swelling and pain. And most of the people that have done this procedure will not be able to sit for about 6 to 8 weeks. So another thing that you have to note here under recovery is fat survival versus fat death. If the blood supply is inadequate, the fat cells are going to die, leading to necrosis. However, if everything goes well, around 60 to 80% of the fat injected is going to be retained, and then the rest is going to be reabsorbed back into the body. So that's how a BBL is done. I hope that was really eye-opening. All right, let us go deeper into things that are never discussed. The first one is fat embolism. So this is the most serious risk. This happens when fat enters into the bloodstream and blocks vessels in the lungs. So of course, the person is going to have shortness of breath, chest pain, and also collapse. This is the reason why BBLs have one of the highest mortality rates in the cosmetic surgery. Any mistake that a surgeon does and fat is injected into the bloodstream, goes to the lungs, game over. You will tell us if you come back. This is life-threatening because fat is not supposed to be in the bloodstream. So this procedure alone is very risky. Fat survival is unpredictable, which means that not all injected fat survives. Typically 30 to 50% may be reabsorbed. And this means that the results may vary over time and you may need to repeat the procedure. I don't know if they tell you that. Sometimes you may do the procedure, everything goes well, and then maybe the fat dies or it's reabsorbed back into the body, and then you will have to repeat the whole procedure. Then also fat necrosis. We have spoken about fat necrosis. This is when the fat cells die. So when the fat cells are not getting enough blood supply, they will die, and then they form hard lumps in your bum. So some they die and then they form hard lumps in your bum, and then this can also become infected. So now this is not only a cosmetic issue, now it also becomes a medical issue. I think I watched this on Botched. If you watch Botched on E, there is a lady who did the procedure, and then she came to the Dr. Nassif and I've forgotten the other guy's name, and she had lumps in her buttocks or her bum. And then she was explaining the whole procedure. This is because the fat cells died and then they formed those hard lumps. So sometimes after the procedure, you start feeling hard lumps, my dear, you need to go to the hospital and see your surgeon again. Another thing that you have to keep in mind is recovery is both physically and mentally challenging. First of all, there's going to be limited movement. When it comes to sleeping, it is disturbed, sometimes because of just the discomfort and also the pain. Then there's also anxiety about the results. Look, even if we go to the best surgeons in this world, you'll always be anxious. What if I don't like it? It is rare, but it is also rare where the surgeon and the patient both love the results. But sometimes the surgeon has done his level best and he sees the results are good, but for you're like, I don't like it. Then lastly, we have the long-term maintenance. Your results depend on your stable weight, your healthy circulation, and proper healing. Now, what you have to know, I'm going to simplify it as it is. Your body is dynamic, meaning that the results are not fixed. Any slight change in your weight, anything, the results are not fixed. Take it as you're hearing it. All right, let us talk about individuals that should not even be thinking about doing a BBL. Number one, women that smoke. Because the nicotine in the cigarettes reduces the blood flow, which leads to poor healing. Remember, we said that everything depends on proper healing, stable weight, healthy circulation. And then number two, people who have severe chronic illnesses, for example, diabetes, cardiovascular diseases, or any issues with your heart. And then also individuals that have clotting disorders. This increases the risk of fat embolism. I already spoke about that. And then also people who have low body fat, because you do not have insufficient donor fat. So what are you going to put there to be put in your bum? Person who is like me, I think, who is like me, I think, like, just don't think about a BBL. Then also another thing, people who have unrealistic expectations. The reason I'm going to refer back to both Dr. Nassif and Dr. Debro, I have seen episodes where a person comes in and they want to remove their ribs and they want a huge size of a bum. And Dr. Debra is like, you know what, we can do this. And they advise them accordingly, like, hey, don't do this. You've reached the max. Anyways, back to the point. When it comes to unrealistic expectations, even if you give this patient what they're asking for, still they'll be dissatisfied even after the surgery. So I think it is smart what they do. They're like, hey, you know what, you have reached the max. We can't do this. Do not go further. And then they leave it at that. They give you the reasonable and the right and realistic advice. Then it's up to you to choose. So if you are still seriously considering going forward with a BBL procedure or surgery, first of all, make sure that your surgeon is qualified, certified, and has experience in performing BBL procedures, is specifically trained in plastic and reconstructive surgery with proven experience. Do not stop there. Even with the best surgeons in the world, they cannot handle an emergency or complication alone if the environment is not equipped. So for yourself, you need to ask, where is my surgery going to be held? Is it in the clinic, the medical center, or the hospital that I'm consulting from? Because right now you might look like a difficult patient, but this will actually help you in the near future. So you need to check out the facility. You need to ask, is it a facility that can actually handle emergencies? Because for your own safety, a facility should have an ICU access in case you need critical care. They should have a blood transfusion capacity in case of bleeding, and they should have an emergency team that is ready to act, that is filled with doctors, emergency physicians, nurses, NEMIs, ready to jump in case things do not go as planned. Because complications do not wait, but when they happen, response time can make a huge difference. It can be the difference between recovery and something more serious. At the end of the day, it is not about the results, but it's about your life. So what is the use of a beautiful looking bum when you're normal? Now that you know what to consider before doing a BBL, how do you recognize a BBL complication? Because complications can happen early on, meaning between hours or days, or later on, even after weeks. So how do you recognize, like, hey, this is a complication that I might have got from my surgery? Let us start with the serious one. For example, if someone has a sudden shortness of breath, chest pain, dizziness, and even they collapse, this is an emergency, and this is something that you could call fat embolism. I already spoke about this. This is when fat enters into the bloodstream and then it travels to the lungs, blocking the blood flow. So when this happens, the lungs will not be able to function properly. Oxygen levels are going to drop, and this is life-threatening. Number two, let us talk about infection. This happens when the bacteria enters the surgical area. So what you have to look out for is, number one, fever. Your body temperature rises because your immune system is fighting the infection. Then also there is redness and warmth around the surgical area. This is because there is inflammation. And then pain, it becomes worse instead of improving. Pus or any unusual discharge from the surgical area, please look out for that. Now, one thing you have to know is, if this is not treated, the infection is going to spread further deeper into the tissues. So make sure that if you see any of these things, go to the hospital immediately and see your surgeon as soon as possible. Definitely, another complication is fat necrosis. So this happens when some of the fat that was transferred does not get enough or adequate blood supply, so the fat cells die. So when this happens, I already said that you will notice hard lumps under your skin and also areas that appear firm, irregular. Sometimes you will experience tenderness, pain, or discomfort. In some cases, if these dead fat cells break down, they will contribute to an infection or even a bad smell. And that is the reason why you have heard some men saying, "Oh my God, BBL smell." You've heard some people say that. No, not all BBL smell. BBL smell if they are infected. There is also deep vein thrombosis, or what we call DVT. After surgery, especially if movement is limited, blood can form clots in the legs. So you will see swelling of that leg, you'll feel pain in the calf, you'll even feel warmth in that area. But the danger is if the clot moves to the lungs, then it will become pulmonary embolism, which is also life-threatening. Another complication is the nerve damage. So this can happen due to the pressure, the swelling, or injury during surgery. So you may notice some numbing, some tingling sensations, or even weakness in that area. So some of these things can resolve over time, however, some can persist. Then lastly, this is not like life-threatening, but it is disheartening to women who have done the procedure. And this is asymmetry, which means that your bums or your buttocks do not look even. So this could be due to maybe the fat cells do not survive evenly in both bums, or the swelling did not reduce evenly in both bums. So one bum is bigger than the other. So does a BBL smell? I think I've already answered this question, but I'm just going to add on a few things. First of all, what you have to know is a healthy, healed surgical site should not produce any odor. And if there is smell, this could indicate a bacterial infection or fat necrosis, meaning that the dead tissue are decomposing. This could be due to poor blood supply or tissue death. So smell is not just embarrassing, but it could also mean a clinical warning sign. I think also people are curious to know if your body can reject a BBL. Well, not in a way that you think. When we talk about rejection in medicine, we are normally looking at an organ transplant where your body looks at this new tissue as foreign and then attacks it. But in the BBL, they are using your own fat from your own body. So that means your immune system will not recognize this as foreign, and true rejection will not happen. But after a BBL, three main things can happen to this fat. The first one is the fat survival, which we all want. Some of the transferred fat cells successfully connect to the new blood vessels. So they get oxygen, they get nutrients, and become permanently part of your body. And this is what everyone who has gone through the procedure wants, and this is what they wish for. The second one is fat reabsorption. Some of the fats do not fully survive. So instead of causing trouble, the body gradually breaks them down and reabsorbs them. This is a natural process, and that is why you will see that over time there will be a slight change in the size, and also there will be a change in the shape. My friend, this is your body adjusting. And then lastly, the last one, which all of us do not want, when things have gone wrong, it is called fat necrosis. If the fat cells do not get adequate blood supply at all, they will die. So we all know that when fat dies, it will form the hard lumps under your skin, and then it can also cause inflammation, and in some cases, it can even become infected. So when you hear someone say, "My body rejected the BBL," what can actually be happening could be that either the fat has been reabsorbed or the fat did not survive at all. That is what is happening, nothing else. All right, let us now talk about BBL creams and oils. You have heard people sell products, say that this product is going to increase the size of your bum, or it is going to shift fat to a certain body area. But scientifically, that is not how the body works. Fat distribution is controlled by things like genetics, hormones, and overall weight, not creams. For fat to increase in a specific area, you either have to gain weight overall or fat is physically transported to that area through procedures like the BBL. So when you apply a cream to your skin, it is never going to transfer any fat from your stomach to your bum. The skin is a barrier. These products do not even go deep enough to affect the fat in that particular area. Another concern is that these products may have unregulated ingredients, for example, steroids, hormone-like substances that could affect your skin in harmful ways. So in simple terms, these creams do not do what they claim that they do. And in some cases, they might even do more harm than good, and also you're wasting your money. So lastly, I want us to talk about what happens to your body in 5, 10, 20 years. Most people think about the results now, the results tomorrow. They do not think about what will happen in a few years to come. Remember that your body is not static. Your body changes over time. So what happens to your body after a BBL in a few years to come? First things first, as you grow older, your skin naturally loses collagen and elasticity. This means that your skin becomes less firm and less able to hold. So over time, even if your BBL looked full and more firmer, you may start noticing some degree of sagging and also less firmness. This is because your skin is no longer as firm as it used to be. So you will notice that people who did BBLs maybe in their 20s, as they grow older, you notice that the BBL starts sagging a little bit down. This is because the skin is no longer as tight or firm to hold it as it used to. Another thing you have to keep in mind is the fat behavior. Now, the fat that was transferred during a BBL behaves like any other fat in the body. When you gain weight, the volume of your bum may increase. However, if you lose weight, the volume may reduce. So that means that the results are not fixed. They change according to your body. Then the third point, even if we do not want it, as time goes on, our body shape naturally changes. This is due to the hormonal changes, to aging or lifestyle. So the proportions that you had right after surgery may not look exactly the same years later. This is because of the redistribution of the fat and also body changes. So you have to also keep that in mind, that as you're growing, as your body changes, because of the hormones, because of aging, because of whatever you are eating, it is going to still affect your BBL. And lastly, over time, gravity affects all tissues in the body. Even the transferred fat can gradually move downwards, contributing to the changes in fullness and shape in certain areas. So I am not here to stop you from going through with your BBL procedure. No, I am here to make sure that you make an informed decision. I'm here to make sure that you understand what a BBL is, what it involves, the risk factors, complications, and long-term effects. Because social media only shows you the result. It does not show you the bigger picture. So if you decide to go ahead and do this procedure, make sure that you're doing it from a place of knowledge and not pressure. Make sure that you choose safety, choose the right surgeon, and most importantly, make a decision that is right for you. Don't forget to like and subscribe. I'll see you in the next video. Bye-bye.